This is the Chamber Link, connecting community, creating impact with Tyler Fischbach.
Good morning, everybody, and welcome back to the Chamber Link for episode 17. I'm Cale Dunwoody, and I have the pleasure of serving as the Vice President of Public Policy at the Fargo-Moorhead West Fargo Chamber of Commerce, and I'm excited to host this morning's Chamber Link episode. On today's episode, we're going to dive a little bit deeper into Minnesota's paid family and medical leave program. For those who may not know, in 2023, the legislature passed in Minnesota a law establishing this program, which is set to launch in January of 2026. This is a critical topic, much like every other topic we discuss here on the Chamber Link, for businesses and organizations, especially in border regions like ours, because compliance is required and businesses need to start preparing for this implementation. Since the beginning of this program, the Chamber has constantly been tracking the law and connecting with policymakers and providing resources to our members. In fact, just yesterday we hosted the paid leave director, Greg Norfleet, in Moorhead for an engagement with over 150 people in attendance. And we know that this is going to be a big change for a lot of our organizations throughout the Red River Valley and throughout our community. And the Chamber just is going to continue to be that convener for the critical conversations like yesterday and today's Chamber Link to help businesses prepare for January 1st. So kicking off this morning's conversation, I'm joined by three fantastic guests, Dr. Brandon Lunick of Moorhead Area Public Schools, Shelly Cummings from Cacheway Distributing, and Matt Gilbertson of Downtown Health and Wellness. Before we jump into the particulars of this program, I'd like each of you just to share a little bit more about yourself and your organization. So we'll start off with Shelly.
Well, as Cale said, my name is Shelly Cummings, and I work at Cacheway Distributing. I'm the HR manager there. I have been in that position with the company for approximately 19 years. And what we are is a broadline food service distributor. So we work with restaurants, schools, healthcare facilities, convenience stores. I like to say really anywhere that you can eat that's not at home is a potential customer for us. And our footprint is all of North Dakota, the upper 2/3 of Minnesota, and the eastern half of South Dakota.
Great. Matt, maybe just a little bit more about you and your organization.
Yeah, Matt Gilbertson. I'm a chiropractor at Downtown Health and Wellness. I've been a long-time resident of Moorhead. I'm half owner of 4 businesses in Moorhead. I've got Downtown Health and Wellness. We just moved from the Moorhead Center Mall, and we're building, kind of kickstarting the downtown Moorhead redevelopment project. Double the size of our clinic, so we've doubled our staff. Majority of the health and wellness are full-time employees, but we also have some part-time employees. I've had the Clubhouse Indoor Golf Lounge, which is historically part-time employees in South Moorhead, and we are in the process of opening up the Forge Fitness Center 24/7. We've got a few full-time employees and a lot of part-time employees to keep the gym open, have staffed hours, and we're putting also the finishing touches on the Oasis, which is a recovery spa on the east end of the mall, right, or the building right there on Center Avenue, between 6th Street and 7th Street.
Great. Well, a lot of irons in the fire, it sounds like. Maybe we'll move over to Dr. Lunick. Maybe just talk a little bit more about Moorhead Area Public Schools.
Sure. I've been in the Moorhead Area Public Schools since 2014. Became the superintendent in 2018, and we've grown to roughly 7,300 students, and we opened this fall, pretty close to completing our high school project. So opening the school year was exciting for us, and watching our downtown evolve too is pretty exciting from a school district perspective as well. So looking forward to the conversation today.
Great. Well, thank you all for joining us this morning. This is obviously a really critical conversation, as I touched on before. And I really was pretty strategic when we're looking at who we want to have join us for the Chamber Link episode on this subject, because each of your organizations is a little bit different than each other. Matt, you have a number of organizations that operate in Moorhead. Shelly, you operate on a bi-state border, and then Dr. Lunick, you're a public organization, and so each of you are subject to this paid family medical leave law, but each of you are doing it a little bit probably differently, and it's impacting your businesses a little bit differently. So really, really excited to have you all in here this morning. Like I said, not every business is created equally, especially in our border community. I think that's one of the unique things we can talk about. The FMWF region, we operate as one region. We're not one sole, this isn't, everybody stays in Fargo or everybody stays in Moorhead. Everybody crosses the border multiple times throughout a business day, and businesses do transactions across that border. And it's just really critical to better understand this, and really excited for this robust panel conversation to provide our listeners today a well-rounded look at the paid family medical leave program and the complexities our region is facing with this. And so maybe we'll just first kind of kick it off with talking about what is paid family medical leave. I think that's really critical, because maybe this is something that somebody hasn't heard of, or you're a North Dakota business and you're not, you operate in Minnesota, but you're used to operating under North Dakota law. Well, I want to give everybody kind of a high level understanding of it. And so let's kick off, Dr. Lunick. Maybe just give the listeners a high level of paid family medical leave. How long is the leave, and what is the purpose of the leave?
Sure. Paid family medical leave, which was adopted by our Minnesota legislature coming out of the 2023 session, applies broadly to most employers and employees. And there are some exceptions to that. There are self-employed individuals, independent contractors, and the tribal nation members are exempt. The challenge here is when we talk about the types of leaves and the duration, there's a medical leave where an employee can take up to 12 weeks, and that could be defined as a serious health condition, pregnancy, and recovery. There's a family leave that could be taken up to 12 weeks, and that includes bonding with your new child, care for a seriously ill family member, military-related illness, those kind of things. And then combined, they can't be any longer than 20 weeks.
Yeah, so a little bit probably different than what you all are used to. You're used to being able to have your own programs, things like that. Maybe, Dr. Lunick touched on it, but maybe diving a little bit deeper on eligibility, who's eligible, who's not eligible. Shelly, can you just, give a little bit of insight into that? I think that's the biggest conversation in our region. Again, operating in a border community, who is eligible for this program?
Well, yeah, that's true. It's been one of the most interesting parts of getting ready for the law. If you are an employer in Minnesota and you employ one person or more, chances are you're covered by this law, and so are your employees. It covers seasonal, it covers part-time. There are very, very narrow exceptions for who is qualified for this law. The complications come in a little more. For example, for us, we have employees that live and work in Minnesota, so obviously they are going to be covered by the law. We also have employees that live in North Dakota and work in Minnesota, or employees that live in Minnesota and work in North Dakota. So determining who was eligible for this program took a little more analysis. So if someone lives in Minnesota and works 50% or more of their time in another state, for example, our administrative employees, they work 100% in North Dakota. And so even if they live in Minnesota, they would not be covered by the law. On the other hand, we have, for example, some drivers that live in North Dakota, but they spend 50% or more of their time working in Minnesota. So they are covered by the law. And then the third category would be somebody who lives in Minnesota, lives in North Dakota, and doesn't spend more than 50% of their time in any state, then they would not be covered by the law. If they live in Minnesota and spend 50% or more of their time working in North Dakota, say, then they're covered. But if they spend less than 50% of their time in any one state, they're not covered. So, and then we have remote workers that, report to North Dakota, but they live in Minnesota, so they're covered. So it's been an interesting interesting time.
Right. Well, a lot of complexities. Well, let's we're going to jump to a first commercial break here. We'll be back with more on the paid family medical leave. Stay tuned. You're listening to the Chamber Link. Well, welcome back to the Chamber Link. As I said earlier, I'm Cale Dunwoody joined by Brandon Lunick, Shelly Cummings, and Matt Gilbertson to talk more about paid family medical leave that's set to take effect on January 1st. We were just, before we hit the break, talking with Shelly a little bit more about who is eligible for this program, and it's a really, really complex system to try to figure out who's eligible, who's not eligible, especially on a border community. I think that's the biggest takeaway is, every situation is very, very unique, especially when you have a company like Shelly's that is operating across multiple different states, and you have employees that live on multiple different sides of the river. And so each situation is going to be a little bit more unique than the other. When you have somebody that's working, across North Dakota, South Dakota, and Minnesota, it kind of goes to, well, where do they live? And, there's a percentage requirement, and it really leans on to, well, the employer is responsible for now tracking that as well. And so, if you're a construction company, for instance, how do you know how much work you're going to have next summer
Right.
In Moorhead versus Fargo? And, you might have somebody that's jumping back and forth. You have a foreman that's jumping back and forth. And so just really complex. So just anything else, Shelly, before we keep going on this?
Yeah, there's just one other thing I wanted to touch on. We were expecting that the eligibility for the amount of time in Minnesota was going to be the same as the ESST, and it was not. It's very different.
And that's earned sick and safe time for the folks.
Right,
Yes.
right. And so we had to do a completely new analysis. We couldn't just say, oh, these folks are covered by ESST. So now we have a bunch of people that are covered in Minnesota under the Earned Sick and Safe law, but do not qualify for paid family leave. So how do you explain to these people, okay, you get this benefit, but not this one?
Yeah. And we'll dive into that a little bit more, too, in our next segments. But let's jump over to Matt on this one here quick. Obviously, we understand that this is 12 weeks of medical leave or 12 weeks of family leave, up to 20 weeks total. We understand that there's a complex eligibility. I think the next big question is, how's this getting paid for? I think that's the biggest question that folks are going to ask, too. So, Matt, maybe talk a little bit about what you know about how this program's getting paid for and some of the complexities with that as well.
Sure. Well, when they first started talking about this, the small business under 10 employees was going to be exempt, and that's kind of where we fit into that bucket a year ago. We no longer fit in that bucket because of growth. But in theory, and I say theory because, if you have under 30 employees, it's 0.66%, and the theory is that the employee will pay half and the employer would pay the other half. If you have over 30 employees, then it jumps up to 0.88%. And when it comes into negotiations for wage and benefits and, the earned sick and safe time, in a lot of instances, if the employee knows, they can refuse to pay up to the 0.5%, and then it all falls on the employer. And yeah, it's 20 weeks, but that's also 20 weeks per year. They certainly could use this, year after year, and then after 90 days, that you have to save their employment. Which, if they're really good employees, as a personal business owner, we're gonna give them time off. When I first opened my clinic in 1999, I had one employee. She got pregnant. I gave her 12 weeks of maternity leave and kept her on payroll because I didn't want to lose her.
Right.
And it's just an added tax is basically what it is for the employer and potentially the employee. And it only drives up the cost of doing business in Minnesota when you don't have those options in North Dakota.
Right. Well, I think it's important, too, to note that that's the current rate that they're at now. Max right now is 0.88%, but the overall cap that the legislature put in is 1.1%. And so it's they just reduced it from 1.2 to 1.1 in this last legislative session. And so reduced it just a little bit, but just for folks out there to keep in mind that this rate can change on an annual basis. And so we heard from Greg Norfleet yesterday, the director of paid family medical leave at the state of Minnesota, that said that they're going to do an annual actuarial study to understand where they're at. So at this point, it's 0.88 for businesses, 0.66 for businesses under 30 employees or less. But it could change. It could change on an annual basis, and I think that's kind of the moving target, especially when you look at some different businesses that are trying to do bidding, things like that. the ball and the goalposts kind of keep moving on everybody. And so trying to have some stability in that program, I think, is key. But to your point, it's another tax on business, and it's really going to be challenging for businesses to try to figure out how they're going to implement this into their existing systems. And we'll obviously talk more about that. But just another thing added onto the backs of businesses and employees at a difficult time. Maybe just, as employers, can you or your employees opt out of this program? Is there, I know we talked a little bit at the break about some exemptions and things like that, but this is to all three of you. Can you opt out? Can your businesses opt out? Can your employees opt out? Or what does that look like?
No, we can't opt out as a business. And, well, the employee can't really opt out either. If we as a business choose that we're going to do the 50-50, have the employee pay half of the premium and we'll pay the other half, they can't opt out either if we're participating in the state program. They can, however, decide not to use the benefit. If we have other programs as a company, and we do, short-term disability and the like, they could decide that they don't want to take advantage of the paid family leave and do the whole process of certification and application and all that.
Well, and maybe diving a little bit deeper too, is there's also an option to do a private plan or a self-insured plan that businesses could opt into. That's kind of their only way, they still have to offer the benefit, but maybe talk a little bit more about that. Is that private plan is, it has to be equivalent to the state plan or better. Yeah. And I know he had said that they're getting some pre-approvals for some private plans. You can self-insure. Maybe just talk a little bit about that and how, what your businesses are maybe thinking about doing.
We haven't decided actually for sure whether we're going to go with a private or a self-insured plan. Those are certainly options. You have to apply to the state, have a lot of documentation that shows exactly what the plan is, what the premium is, what it covers, make sure that it covers everything that the state plan does, and then you get approval from them. But you still have to follow the administrative rules of the state as far as notification to your employees and making sure they understand what the benefit is and how they have it. If you choose to go with a private plan, obviously you'll be paying your premium to that plan. You can still cost share it with the employee, but it can't go above whatever the rate is that's set by the state. So currently, you couldn't charge them more than 0.44%.
Yeah, so I think that's maybe another complexity to throw in there, but maybe just before we go to our next break here, Dr. Lunick, maybe just talk a little bit about what are the options you have as a public entity. Do you have the option to go to a private program, or what are you guys thinking?
Yeah, we have the same options. We could choose a private plan, but again, it must meet or exceed what the state does. And we've looked at that, and right now our brokers are telling us that there really isn't a difference in terms of what the cost would be. So we'll continue down the path with the state plan. I think the one thing that concerns me as we move forward is this first year when it's starting in January. I think our payroll tax is going to be around $300,000. So next year we're budgeting $600,000. And we get paid on a per student basis. So if our student population goes down, chances are you can reduce your staff to fit that, but it's got to fit within your ratios and everything else. So it's not as easy as if your enrollment goes down, balancing that $600,000. And then our concern is, when are they going to tell us that if the tax goes up?
Right.
We have a budget cycle we have to follow, and if that comes after we've set our budget, then we've got to figure out a way to absorb those costs. So we have a lot of concerns with that, the ability for it to go up, because I don't really think that it's going to go down from the 0.8, from the 0.88 where it is today. So I hope that when they get to that their timelines are, friendly for private sector as well as public sector, because our calendar runs different. Our fiscal year runs June or July 1 to June 30th. So I'm anxious to see when and all of these things come out in terms of when we can expect to see any of those changes. So difficult to budget for at times.
Right. Well, I think that's why I wanted to have a myriad of different entities join us this morning just to talk about that a little bit further, because it's not all, again, not every organization is created equal. You're operating in a very, very different business model than, maybe downtown health and wellness. It's very different. And so, but as we come back, I just want to talk a little bit more about this program and dive a little bit more into the impact. So stay tuned. Welcome back to the Chamber Link. Thank you all for tuning into this important discussion on paid family medical leave. During this next segment, I want to dive a little bit deeper into the complexities of this program, if it wasn't complex enough already. Dive a little bit deeper into that and how this is impacting organizations like yours and others throughout our region in the state of Minnesota. One of the biggest challenges we heard early on from businesses was workforce shortages. Obviously, no business, no entity, public, private, is exempt from the workforce shortages that we're seeing all across our region, all across the tri-state region, across the entire nation. And so I know, Matt, you had talked a little bit about kind of when you first started your business and you took care of your employee because you didn't want to lose her. Well, now how do you think that this program is going to impact, your workforce shortages at, your organization? Say somebody's on leave already, and then now you have this implemented, and now 3 more people are able to take leave at the same time, and you have no staff or whatever it may be. Maybe just talk a little bit about how that's concerning for a business like yours, given the circumstances of workforce shortages that we're seeing.
Yeah, and I can speak on behalf of probably most small businesses, or probably all businesses. You can handle certain sick days, and you can handle certain short-term disruptions. But if they come in and say, I'm taking 12 weeks or I'm taking 10 weeks, to not only just care for a child or a family, but it's extended family, and it's, pretty broad on what somebody can take.
Yeah.
We'll have to figure out if it's 4 weeks, can we survive with, can the rest of the staff pick up the difference? But what happens if everybody is off for 12 weeks? Then we've got then we've got a financial problem too, because now we've got to replace them. Training's expensive, and you're not going to find somebody that, hey, you want to come work for 4 weeks,
right?
So it's just a lot of indecisiveness and just not knowing what, and they're not going to get 100%. They're not all employees are going to get 100% of their pay. So more than likely, they're not going to use it all or take it. It's going to be a dire situation,
right?
Where their best bet is to take some time off. And we can't afford to hire somebody extra just to have a floating,
right?
just to have, for the what ifs,
right?
And I remember back when we all met with Senator Kupak, and he was bragging up that, now people can stay home longer, they'll need less daycare. Well, but then also these employers that those people are working at are also going to be taking time off. So the net gain is still 0 to minus. It just doesn't structurally make sense for the employers,
right,
and the employees for that matter.
Right. Maybe just quickly, Dr. Lunick, obviously a little bate different in your organization. You don't necessarily run a business, but you run a business and you have to have people there to educate students. How are organizations like yours dealing with this kind of what if scenario? What are some of the impacts that maybe you're already seeing for people taking leave and not being able to offer different courses or things like that? Maybe you just want to talk on that quickly.
Well, we might be a public organization, but we're really not much different than Matt in the way he has to cover his absences, because for us, a day of instruction is a day of instruction, and if day 100 goes and it's gone, you don't get it back.
Right.
And so Matt talked about in his business, he's got trainers and very specialized in what they do. We're in the same boat. We only have to replace, in fact, if a teacher goes out, for 20 weeks, we got to hire a long-term sub. So that kicks into another level of pay for us, because it's not just your sub that's coming in for one day and the teacher then comes back. I also think there's a larger long-term effect here for a public school, because kids need continuity. And if their regular teacher is out for 20 weeks and we put in a long-term sub, those kids then get used to that long-term sub, and then the teacher comes back after 20 weeks, and we have a 36-week year at 4 quarters with 9 weeks in them. So it becomes extremely challenging on much the same standard or level of care that we have to provide, just like everybody else has to provide. And I'll give you examples. Substitute teachers are in short supply too. So for instance, in the month of September last year, we had 85 absences. We were only able to fill 64% of them. And that left 32 jobs that we filled, and we couldn't fill 18 of them. Now, I think this could make that a little bit more difficult as they're gone for longer periods of time. We're taking from that same pool and putting them in our long-term sub pool. And that's only on the certified staff. We're not talking bus drivers. We're not talking paras. We're not talking supervisors, food service workers. This affects us in all areas of how we have to deliver our product. But again, I emphasize that although we are considered public, I don't think how this is going to affect us is a lot different than how it will affect those in the private sector.
Right, for sure. Well, and Shelly, I'm sure you could probably talk a little bit about it too, from the CDL drivers. I'm sure there's not a plethora of those guys running around, guys and gals running around. I mean, and people want to get fed. They want to be able to go to a gas station or a restaurant, and they expect their food to be there. And I'm sure those. I think when you look at some of those certified employees, it's a little bit harder, just like Dr. Lunick just said, to have a big pool of them just waiting to be able to say, hey, I'm ready to throw my hat in the ring for 4 weeks. Any last comments on that?
Yeah, absolutely. I mean, now, even before this goes into effect, that's something that we're constantly battling. A driver goes out on an injury on workers' compensation, say, for example. Even now, we have trouble covering those long-term absences. So I can't imagine, I am imagining throwing this into the mix and how much worse it's going to be.
Right. Well, maybe going back, just Dr. Lunick, I want to kind of go to benefits. I think that's kind of the other big component to this. Obviously, the workforce side of things, but then also the benefits side of things. And you have to deal with a few different aspects of offering, compensation packages and negotiations, given that you're a public entity. Could you maybe talk a little bit more how this paid family medical leave impacts contract negotiations and collective bargaining agreements for Moorhead Area Public Schools?
Yeah, so this session, we're negotiating with food service and their certified staff I'll say this summer. The next summer, it's every other bargaining unit. So how this will impact us will remain to be seen. We're interpreting the statute to say that it's going to be a 50-50 split. So right now, with our 2 bargaining groups, we're working through that. I'm anticipating that the next summer's bargaining units will be watching very closely on how we handle these 2.
Right.
And so, but we've been pretty clear that that will be split between the employee and the employer, and they've been relatively receptive to that.
Matt, maybe just jumping over to you on that, obviously compensation and benefits are a negotiation already for private entities with their employees. How does this add a little bit more complexity to that now that there's an option for the employer to pick up all of the payroll tax or only half of the payroll tax? And then maybe also just in that kind of same vein, talking about offering other benefits. Obviously now you're having to pay for this program. Can you still afford to pay for other types of programs? What does that look like from a private business perspective?
Well, it's certainly going to make it more difficult, because majority of the employees look at their net pay. They want to know what their net pay is going to be.
Mm-hmm.
And majority of the employees that we want to hire are not going to be. They're going to think that they're not going to need this kind of benefit because we already offer PTO, holiday pay, and sick pay, and it's cumulative. So they're gonna look at it like, I'm not going to need this. And then once they realize they're not going to use it, they're gonna start looking at what their net pay is. So it's probably more down the road than it would be the initial. But then the state also wants to dictate what our PTO and sick time is. So they kind of got it coming at us from both angles. It just adds a extra cost to both the employer and employee.
Right. Well, I think that's the other aspect of this is that there's multiple different programs rolling out across the state of Minnesota that earn sick and safe time, others. But maybe, just jumping over to you, Shelly, here quick on that subject. Obviously, there's also some federal programs like FMLA. All of these things have different requirements, different eligibilities, different definitions of what family and other things are. Can you just kind of talk about that complexity a little bit from an HR perspective? And I know it's a broad, but when you're looking at the different and obviously Matt talked about it, definitions of family or the definition of safe time, things like that. Can you just kind of give us from an HR perspective what that looks like?
Excuse me. I think because ESST and the Paid Leave Act in Minnesota both cover this safety, but most of the other acts don't. So the things you're going to wind up stacking and run concurrently, and they all say, oh, you can run this concurrently with your other programs. That's where you're going to start running into problems. There's, as Matt mentioned, FMLA. There's now the Minnesota, the paid family leave. These can also intersect with ADA. Sometimes leave is a reasonable accommodation for the ADA. The eligibility for Minnesota and FMLA is different.
Mm-hmm.
The reasons you can take it are, well, I shouldn't say they're different, but with Minnesota, you can take medical for yourself and then a caregiving role for up to 20 weeks, as Dr. Lunick alluded to. And with FMLA, you can't do that. Mm-hmm. It's a maximum of 12 weeks. So trying to coordinate them all, what you're eligible for, when you're eligible for it. Does it belong to this program? Does it belong to that program?
Right.
It's going to be very complex.
Yeah, for sure. Well, we're going to jump to our last break here, and then we'll get back to you. Matt has one more thing, so we'll get back to you after our break. Well, welcome back, everyone, to our final segment here of the Chamber Link. A lot of great discussion in the break there. But Matt, you had one, and I had to cut you off there, so I apologize. But wanted to go back to you real quick as I had to end there. So, go ahead.
Yeah, I just was, as Dr. Lunick was talking about long-term subs and filling in for the 20 weeks. You can't hire an independent contractor, right? You can probably get some independent contractor truckers, but then they're not quite as reliable, and that creates a whole nother set of issues. But the independent contractors aren't bound by this law, So employers will put in independent contractors if they can, but you can in the school district, and then, so long-term sub A shows up, and then how long before all of a sudden they're out for 20 weeks?
Yeah, that's the challenge, and that's what we're trying to plan for right now, is because you can't predict those things. But there's a lot of times where in this situation, once it starts playing itself out, we could actually have 2 vacancies for 1 position, and that when you're already strapped on your sub pool, then that makes it even more difficult to fill your sub openings, and the amount that you leave unfilled just continues to climb. And then I think for the staff that are there's a lot of frustration because they are then forced to pick up and take on some extra kids for the areas in which we can't fill.
And then the stress becomes exponential on the people that are
there.
That the people that are there that are filling in for the ones that, that are out.
Yeah. Yeah. It's, I wish we had 4 more hours to talk about this, but I know we're getting close to our time here this morning, but don't want to be all negative. I want to, look at maybe, is there a positive to this? Obviously we talked a lot about the challenges. Maybe what are the, very quickly, what are the positive impacts of this program? How do you think that this will help our community? Again, I want to stay positive on some of this as well. Is there any positive that you see to this from your business perspective?
Well, the positive would be if we knew, like pregnancy, for example, right? If the state program is going to pay for their 8 to 12 weeks of maternity leave, that's less of a burden on us.
Right.
But from a day-to-day operation and, well, we saw it during COVID. People will take advantage of a situation if they certainly can.
Right.
So there's way more negatives than the small short-term positives I can see from a business aspect.
Yeah. Well, just kind of wrapping up here a little bit, but just yesterday we hosted, obviously, Greg Norfleet to talk more about the rollout of this program and provide organizations with some more clarity on the program's complexities. What were a couple key takeaways for you? And then how are you feeling about the rollout? Maybe Shelly, we'll start with you.
Well, I did learn a couple things yesterday that I didn't know. I was glad to find out because we, even though we're likely going to have a small number of people in the program, we're actually going to have 3 accounts with unemployment. One because we're 2 separate limited liability corporations. So we already have unemployment accounts for each of those. Plus, we're going to need a 3rd paid leave only account for those employees that live in North Dakota, but so we're going to have, and we'll be able to have one administrator handle all 3 of those accounts, which is a plus. I also was not aware that the 0.88% was or is going to be based on post-tax wages. So that's heartening. That will lower the cost somewhat rather than, the gross, having it pay it on the gross wages. So that's good. I haven't had many difficulties with the state yet. So far, it seems to be going fairly smoothly. Our difficulties in getting prepared for implementation have really been more with our payroll vendor. It's such a complex law. It seems like they're having difficulty understanding what we really need.
Yeah. Maybe just quickly, so we're almost done with time. How are you feeling about the rollout?
Well, I think we're doing everything we can on the rollout. I think from a human resources perspective, we know the deadlines. We know what we have to get accomplished. We know what has to get sent out by December 1st to be ready for January 1st.
Right.
But like Shelly was saying, I think one of the biggest challenges we have is because we've got all these multiple programs at play, plus our own.
Right.
We're trying to find an adequate software that can help us track all of it. And right now, I mean, we got a Google sheet to cover this and a Google sheet to cover this, and they're interacting, and we're literally, when you got 1,000 employees, you're pulling your hair out trying to figure out, okay, well, they have this now, and then they got to go to this. So we're really trying to find that perfect software to help us manage that, which then is going to be a capital investment.
Let me know
for
when
us.
you find it.
Alrighty. Well, looks like we're at time here, folks. So just really appreciate y'all staying tuned for this episode of the Chamber Link. If you have any questions on this, don't hesitate to reach out to the Chamber or Minnesota Deed. Thank you for joining.